Hello, everybody. I'm Dr. Neelesh Bangalore. I'm a medical oncologist and a hematologist. I am doing this blog mainly to answer some questions about COVID 19. My family has asked me a lot of questions about this disease and what the expectations are. And I feel that there is a lot of hype and a lot of fear that is being generated by all the information in the press, on the internet. And I thought I will try to put an objective face to this and give you some facts that are quite reassuring. I must also tell you that things are changing. For example, in late February, early March, we were told not to use masks, and now it has become mandatory. Initially, the impression was that patients who are sick and who have multiple medical conditions are the only ones at risk for getting this disease and transmitting it. Now we know that young, healthy people can actually get the virus and transmit it without having any symptoms. Therefore, it's possible that 2 weeks later, there may be new recommendations as we learn more about this virus. Another question that is asked is, how is this virus spreading? We know that initially this virus was discovered in a specific area in China where there were wet markets that led to close interaction between animals and human. So the initial spread was from animal to human contact. But now we are seeing that the main spread is human to human contact. And that has become so prevalent that this virus is now literally present in almost every country. And all the precautions that we are taking in terms of social distancing, in terms of quarantining ourselves, all hopefully will decrease the spread. In addition, all the hygienic precautions like hand washing, using hand sanitizers, not touching surfaces unless they are clean, these are some measures that will also help in decreasing the transmission. Many people ask me if they have a cold or a cough, do they have COVID-19? And my answer is a firm no in most cases. For somebody to test positive for COVID-19, they have to have an exposure to an individual who has tested positive. If that history of exposure is not there, it is very unlikely that somebody with symptoms such as a fever, a cough, or a cold has COVID-19. There are many other upper respiratory infections that have similar symptoms, and they are quite non-specific. If there is any doubt in anybody's mind, they should call their primary care physician, have a discussion over the phone, and then come to a conclusion whether a test needs to be done or not. Doing a test out of curiosity is not recommended. We are certainly having a shortage of the number of tests that can be done, and selecting the right patient is very important. Many of my staff members ask me, if somebody gets COVID-19 infection, do they ultimately die? And again, my answer is a strong no. In fact, almost 90% of patients who get this infection recover from it at home using supportive measures, hydration, taking medications for fever, taking medications for pain. About 10% of patients may require medical care in the hospital. approximately half of them may require intensive care admission. And patients who are on a respirator unfortunately have the worst prognosis. There is a high mortality associated with that. So, in summary, most patients with COVID 19 infection actually survive. We don't know what the long term consequences are, and that information will come as we go along. But the mortality rate is about 5.8% across the world. I also want to give you some specific numbers. As of today, 1.5 million people are infected with the COVID 19 virus based on testing. 88,300 have died. That's a mortality rate of 5.8%. That means 94.2% have not died, which is much better. We wish it was 100%. Unfortunately, in Italy, the mortality rate is 12%, whereas in the US, it is about 3.4%. And in California, it is 2.6%. Is there a vaccine available for COVID 19? As of today, we don't have an established vaccine that can be used for the general population. There are studies going on, and as Dr. Anthony Fauci mentioned, it does take time to establish the safety of the vaccine, the efficacy of the vaccine, and how it's going to be packaged as a product. So it will probably take about a year to year and a half before we see a final safe product. Are there drugs to treat this condition? As you may have heard, hydroxychloroquine is now discussed almost on a daily basis. It is a pill that is available to treat lupus and rheumatoid arthritis. It has been studied in China, 2 separate studies. There is a possible hint of a benefit. However, after the analysis of both of those studies, there is no clear-cut benefit in terms of clinical improvement, and it is something that doctors can prescribe to their patients on an individual level, but it cannot be recommended yet as a standard treatment for COVID 19. Hydroxychloroquine plus azithromycin was tested in France. Again, those studies are inconclusive. There was one death because of a heart rhythm problem. And again, I would not conclude that is a treatment for this condition yet. It has to establish itself. There is a drug called remdesivir, which is being studied in clinical trials very actively. It was available as a compassionate drug. That means drug that is used even though it's not FDA approved. There are many clinical trials going on, and we are waiting for results to determine if that will be a treatment option. One of the promising options is use of convalescent plasma. Patients who have had this disease seem to develop antibodies in about 7 days, and that seems to be responsible for getting rid of the virus. And it is now recommended that patients who have survived this disease should donate their plasma or should donate blood so that their plasma can be used to treat other patients. The last category of drug that may have some value are immune modulators. It is believed that when patients become very sick with this virus, especially patients who are on ventilators, have significant lung damage, it may be because of body's immune response, and therefore there are drugs that are being tested that suppress the immune response. And again, time will tell if that would be a useful strategy. In summary, what I want to say is that we are going through difficult times. We are being bombarded with information about the number of cases that are found every day and the number of deaths that are happening every day. But it is important to remember that 90% plus patients will recover from this disease. Also, good to remember that the mortality figures have not changed dramatically. The relative mortality has remained roughly the same. And with all the interventions that we are doing, I am very confident that the mortality will start to decrease to near zero levels. Please keep this perspective in mind. Thank you.